Hi, I'm Dr. Admani. I'm an interventional cardiologist and a general cardiologist at Bergen Newbridge Medical Center.
If I live a healthy lifestyle, does my family history of cardiac disease still put me at risk?
Your family history of cardiac disease does increase your risk of heart disease, even though you live a healthy lifestyle, because some of the genetic factors are not altered by your healthy lifestyle. So even though a healthy lifestyle does help reduce your risk of heart disease, the genetic factors are not altered due to your family history of heart disease.
I eat right and exercise regularly. Should I be concerned about my cardiac health?
If you're eating right and exercising on a regular basis, you still need to be concerned about your cardiac health. For one reason you should be concerned is if you have a family history of heart disease. Once again, genetic factors are not altered by eating healthy and exercising on a regular basis. So there are some factors other than just exercise and eating healthy that still do contribute to heart disease, and they need to be assessed as well.
What types of screenings and tests should I have to determine my heart health? At what age should I get screened?
I personally think we should be getting screened people in their mid-40s or early 40s. Males as well as females should be screened whenever they reach that age. For females, menopause is a big change. Although we don't talk about menopause in male, there does exist an entity where male hormones are also being reduced, and that contributes to the development of disease processes. So mid-40 is a good time to start screening for heart disease. Some of the screening tests that we're advocating these days are looking at your cholesterol, using a lipid profile. You can also look at the Lp(a) protein, which has gained popularity as a good marker for coronary artery disease. The other testing, such as scans we're looking at these days, are calcium scores to see if there's any calcium in your arteries, and that correlates well with any cardiac events in the future. Newer technologies, newer scanning imaging modalities have improved tremendously. So coronary artery calcium as well as coronary artery angiogram using a CAT scan are also used more frequently now than we ever did in the past. So a combination of those testing can be used to start the process of getting screened.
What are the best dietary choices for heart health?
The best dietary choices can be very confusing. Everybody seems to think their diet works the best, but at this point, with all the research that has been done, the Mediterranean diet seems to be the one that has shown most promise. The Mediterranean diet is what we are recommending. There have been studies in the past showing that it can reduce your cardiovascular events by 30% in some populations. So that's the diet that we are encouraging people to look into. The diet mainly includes fruits, vegetables, nuts, olive oil. Virgin type is a big component of Mediterranean diet. So at this point, with all the research that has been done, it seems that the Mediterranean diet appears to be the best as far as heart disease is concerned and prevention.
What type of exercise is best for heart health?
So we always advocated cardiovascular exercise. The American Heart Association recommends 30 minutes of exercise 4 times a week, or even 40 minutes 3 times a week. However, lately we are also seeing tremendous benefit from exercising in a form of resistance type of exercise. So using any type of resistance, whether these are resistant bands or light weights. So improving your muscle tone, increasing your muscle mass, has also beginning to tell us that it's also beneficial in terms of preventing cardiovascular disease processes as well as other disease processes and aging. So the recommendation is changing a little bit to include some sort of a resistance type or lightweight type of exercise in addition to cardiovascular aerobic type of exercises.
What questions should I ask my doctor about my risk of heart disease?
Your risk of heart disease depends on what kind of risk factors you have. You could ask your doctor as to what your risk factors are for heart disease. Some of the risk factors that we are concerned about: high blood pressure, cholesterol, diabetes, smoking, sedentary lifestyle. Family history of heart disease is also a strong predictor of future events, so that also should be incorporated in evaluating your risk of heart disease. Your doctor should be able to gather this information and put it into one of these new risk assessing calculators to give you your 5 risk assessment of heart disease.